Good morning, good afternoon, and good evening. Welcome to the 1626th day of 24th day of continuous and uninterrupted Zoom session of IFPH. Let's start today's program with a silent prayer for a minute. Thank you and welcome back. Today we have with us Dr. Hubert De Silva, BHMS, MSc Psychology, Chief Physician, Homeopathy Clinic, Karakutam, Trivandrum, Kerala, India. 35 years experience, moderator of IFPH. We all know that him. No more introduction is needed. And the topic is management of cardiological disorders, homeopathy part 5. So on behalf of IFPH and record of Hubert De Silva, you can have a platform for the next 45 minutes. Please.
Thank you, Dr. Manoj. Thank you all. Today, can you hear?
Yes,
can you hear me?
Yes, no problem.
Okay. No problem. So, it's a good day after. Okay. Let me share my screen.
Yes, okay, please.
Matthew 15:17 says that, don't you see that whatever enters the mouth goes into the stomach and then out of the body. But the things that come out of the mouth come from the heart, and these makes a man unclean. For out of the heart come evil thoughts, murder, adultery, sexual immorality, theft, false testimony, slander. Slander means saying something bad against certain persons, false saying about some persons. These are what make a man unclean. But eating with unwashed hands does not make him unclean. That means we have two hearts, one a muscular heart and an invisible heart. These are the two hearts we have. It says that, for out of the heart comes evil thoughts, murder, adultery, sexual immorality, theft, false testimony, slander. All the bad things are coming from heart, and also the good things are also coming from our heart. This is the human life. Let us go to heart. So we must keep our heart very nice. Today we are discussing about what are the functions of how to control our heart. What are the controlling forces that makes our heart? A healthy heart, a weak heart. How to make a healthy heart? That is what we are going to discuss. We should know that which are the controlling stations or the controlling forces of the heart. Last time we talked about many subjects, but now, today we are talking about the heart functions and what are the forces that makes the heart strong. There are mainly four types of regulations of our cardiac activity. Those are regulation of the cardiac activity, intrinsic regulations, extrinsic regulations, neural regulations, and hormonal regulations. These are the four main heart controlling forces. One is intrinsic regulation. That is inside the body, our body having something that may affect the body heart functions. Some other forces that is from outside, that is extrinsic regulation. There are so many extrinsic regulations. One person is a dog chasing a person, That is an extrinsic regulation. Our heart may beat strong, and if we are having some fear, anxiety, or something like that. And the other one is neural regulation, that is the brain and our nervous system that is controlling our heart. The other thing, hormonal regulations. Hormonal regulations are, we know that there are so many chemicals, so much chemicals and so many types of chemicals in our body that may affect the functions of the heart. The main function, that is the central nervous system, parasympathetic control of the heart rate refers to the ability of parasympathetic nervous system to slow down the heart rate by releasing acetylcholine. Parasympathetic control of the heart rate refers to the ability of parasympathetic nervous system to slow down the heart rate by releasing acetylcholine. Why the heart is slowing down by the parasympathetic nervous system? Because when it is excited, very much excited by any fear or anxiety or anything like that, from what we said, extrinsic forces, one is very much afraid, facing others. That time the BP pressure will increase. Our BP will raise. That time parasympathetic nervous system is very essential for to control our heart rate. The volume of the blood vessel going in and out will change. The other thing, here we know that releasing acetylcholine, that is making primarily through the vagus nerve, which acts on the receptors of the heart to decrease its rate of contraction, essentially promoting a rest and a digestive state in the body. The rest is very much necessary. It is very much needed for a person. If we are agitated by psychological factors, then we will not get a good rest. That is another thing. We won't get good sleep. We cannot relax properly. That is a major thing when we can see. In such conditions, we may get a rest by giving rest and digest state in the body. This is the dominant control mechanism during resting condition. A person wants to rest. Sometimes a person is lying down. Even he is lying in a good bed, very costly bed, but he won't get sleep. One often, a rich person once said that, what is a man is blessed? How a man can be called that person is a blessed one? Normally, we may think that he's having a big car, he's having a big building, he's having riches, and he's having a very beautiful wife and children. That time we may call it as he's a blessed person. But in another term, if we are asking that person, are you a blessed person? Then he will say that I am not a blessed. I'm always having tensions of how to live. Even though every physical things are there, he will not be in a rest position. That is a rest. It is a blessing. A resting, getting rest, getting good sleep, getting a difficult passing stool in a normal way, passing urine in a normal way. These are the important things. Whenever we are, if sometimes obstructed, our urine passage is obstructed, the passage is obstructed, our life is gone. If we cannot pass stool, constipation, these all will make us very much anointed. In a state of condition that is not in a happy condition. So our health, that is why the old people all says that health is wealth. Now let us go to the other part. How does the parasympathetic system control the heart rate? The parasympathetic system releases the hormone acetylcholine to slow the heart rate. Such factors as stress, caffeine, and excitement may temporarily accelerate our heart rate, while meditating or taking slow, deep breaths may help to slow your heart rate. That is what we're doing in yoga. Let us see here. Now we saw the different heart is affected, very much affected from brain, from different parts of the body, the other liver, kidney, and where the nervous systems all are causing and affecting on the heart. Let us go to the screen share. Can you see it?
Yes, yes.
Okay. The neural regulation of the heart is a process that involves the autonomic nervous system and various areas of the brain. The ANS controls the heart rate and control contractility through the sympathetic and parasympathetic, which is already said. These are what is neural regulation of the heart? The regulation of the heart and peripheral circulation by the nervous system is accomplished by control centers in the medulla that receives dissenting input from higher neural areas in the brain and afferent input from the mechanically and chemically sensitive receptors located throughout the body. All areas will affect heart. And heart is affecting all the parts of the body. Why heart is so much important? Which is the first organ in our body which created? That is heart. In the womb, first organ is created is heart. After that, the formation of the heart, then each and every organ of the body, again, developing that, growing. Now, let's go. Heart functions. We know that this is a picture of the heart and the chambers. This pulmonary area, this right atrium, right atrium to coming blood to left right ventricle, and it is passing through this. It reaches to the lungs, and again it comes to the left atrium, and it comes to the left ventricle, and it may go from here to aorta and all other different parts of the body. So, one more thing, let us see. Blood is coming from the different part of the body. It reaches here and goes there, and going to from lungs, it comes to the ear and comes to the left atrium. It is the normal functioning of the body. See how heart is moving. There are different types of moving inside the heart. Oblique moving, transverse moving, lateral moving, and medial moving. And the heart, the only one part of the body which is moving, heart and lungs. So this is happening whenever our body starts till our end. If it stops for some time, what will happen? The heart rate is hearing You can now also hearing the heart rate. Each and every human being have this heart. It starts till when our life starts and till the end of our life, it may go. But it is affected. Which are the parts? Let us see. We can see that diaphragm. We have a diaphragm. That diaphragm is also going up and down all the time. If the diaphragm is pressing by the intestines, if we have taken more potato, more dal, something like that, which creating gas production in our stomach, it may affect the heart functioning. If the lungs is not functioning properly, or the tuberculosis is having the lungs, that time the lungs will also, the elasticity of the lungs will reduce. And we know that the calcification of the other things after coming this, that time also, same functioning, the heart will not function. There is pressure. There will be pressure in the mediastinum. We know that the mediastinum, space occupying diseases, lung cancer, lung emphysema, and sometimes if there is pneumonia and viral infections, that time the lungs is painful, that condition also, it may affect the heart. But when considering all these cases, whenever we are watching a patient, we have to watch which one is affecting his heart. Which are the things affecting his heart? Then the heart, how it is affecting the other parts of the body. Whenever we are taking the case, we have to watch it carefully that how the heart is affected by different parts of the body. If one person having diabetes, we know that time if the diabetes condition is more, the sugar condition is more sugar is production. That time our peripheral system, the coming of the blood will reduce. The quality of the blood will change. Whenever a man making smoking, that time the nicotine and the toxins in the body may raise. It may affect the blood vessels and it may affect the heart. Let us go on more. Share. I can't stop it.
You please go to the topic, doctor. Management of cardiac disease. That's the topic. Please. Yes, that's good. The technical problems you are facing, will share the screen.
What is the most common valve defect? The most common valve defects are mitral valve prolapse, the most common heart valve abnormality, and the number one cause for mitral regurgitation. This is when the mitral valve doesn't open and close properly. Mitral valve, we know that in the left atrium and left ventricle, there the mitral valve will sometimes, we know that, rheumatic heart diseases, calcification of the blood vessels, and viral infections, chronic tonsillitis. And this may affect the functioning of the mitral valve. That time it may prolapse. That time it may prolapse means the blood will again go back. The volume of the hypertrophy of the heart may produce. That time, heart may have pain and becoming more and more bigger, and the size of the heartbeat. In heart conditions, what are the management procedures? We know that we have medicines. Homeopathic medicines are very much essential for the treatment of this type of conditions. We know that in tonsillitis, a person having tonsillitis for several times, quinsy and pains of the legs, paining of extremities, that may not naturally, it may go up and reach the heart. It comes from the periphery to the heart. When this is happening, we can control it in the early times. A child having this type of problems. Nowadays, there are some problems. We know that. Why nowadays, so many having pain of the leg, ladies having pain. What is the main reason for pain? In our childhood time, there is no such pain, and peripheral pain, lower limb pain are not very common. But now it is very common, and I think that 90% or 99% persons having this type of pain. Why? The standard of living is changed. We all are they make their homes with good marbles and tiles and very costly tiles. It may get very much cold. In a cold condition, our blood will becoming more and more. The temperature of the blood will reduce at it. That is one of the main reasons for pain of the extremities, pain of the legs. And it may affect the whole blood. The temperature of the blood will reduce. That may one of the main reasons for nowadays we can see. These are the heart rate, regulation of heart rate, neural control during exercise. We already discussed about neural control, chemoreceptors, baroreceptors, proprioreceptors, sympathetic and nervous system, cardio control centers, parasympathetic nervous system, accelerator nerves, SA node, increased heart rate, vagus nerves. Another main reason for heart disease, we have gone the electrical conduction system of our heart. We know that electrical control system, the SA node, AV node, and bundle of his Purkinje fibers, these are causing the functioning of the heart. The normal condition of the heart is reducing. We know that whenever the age is going up and up, our all system will becoming cool and cool and cool. What we are doing, we have to control the heart and our health. We have to make ourselves, we make our body more heat and get heat. How we can get it? Through exercises. We know that in yoga, in pranayama, we can increase our heat of our body. The blood system, we can make the body. What is happening in the exercises? When we are doing exercises, the body temperature will rise. After that, the blood vessels will increase in size, the lumen will increase in size, and the blood flow will happen. And the nutritions will get. The absorption from the abdomen, from our digestive system, we may get nutritions and everything. One day a person came to my clinic. He told me that, doctor, I have severe headache. I did many treatment and I feel that this headache is not, I don't get any relief. But I asked him, how is your food habits? He told me that I'm taking very less food, very low quantities of food. Then I addressed him. There are so many blood contents in your body, which carry the blood from the food materials to your head. If you are not taking sufficient food, you will not get the nutrition to properly in the head and other parts. You take more food, you take more sugar, you take more salt. Normally, his condition becoming normal day by day. Normal. So these are some of the problems of taking not regular life normal life. They are not leading a normal life. If we are taking a normal life, we can change our all the things. The other thing, these are this adrenaline in the blood, baroreceptors, acetylcholine, carotid sinuses. Here all we can see that from the nervous system, these are all the areas which may affect each and every region of the heart. We may think that all are affecting the heart. No. From the central nervous system, it may affect the afferent nerves, affecting otherwise the carotid sinuses. Some are affecting the aorta. Some are whole heart is affected with sinus nodes and AV nodes and noradrenaline. These chemicals, adrenaline in blood, this is affecting, it is increasing our blood vessels itself, regulating our heart. Sympathetic system, already said, these are all different parts of the heart. The outside heart and inside heart is affected by many nervous systems. And at the same time, the peripheral nervous system also having these type of regulations. Each and every small capillaries, even the capillaries and the arteries and veins and small venules, these are all affected with nervous system. These are all affected with.
Yes, okay.
Okay.
Yes, visible.
There are short-term control. We already discussed about these are the sympathetic activation, adrenal glands release epinephrine, norepinephrine. Some are long-term control. Long-term control of heart. That is, sometimes it may lead to a chronic disorder. Kidneys produce renin, erythropoietin. These are long-term conditions. These are short-term conditions. Cardiac output may be the peripheral vasoconstriction, blood pressure. These are all immediately happening and it may come to its normal stage. Sometimes it may be a long time problem. Kidney produce renin, erythropoietin, angiotensin activated, antidiuretic hormone released, aldosterone secreted, thirst stimulated, increased red blood cell formation, blood volume, homeostasis. This all should come to the homeostasis. But when we are taking a case, these are all things we must consider. We are only, if we are going to the medicines only, we are talking about the materia medica only, we cannot go through all these things. If we are in a scientific way of treating a case, we have to check. We have to know what are the possibilities may be happening in a patient. These are the changes may affect the heart. Even the kidneys is not producing its production or the renin production. It may affect. Whenever we are taking water shortage, that may affect the function of heart. Whenever the blood is thickened, it may affect the heart. When the blood is very much thinner, it may affect the heart. That time the production of blood or the number, if we just imagine that if the blood is 6 liters, we are taking 2 liters of water, that means that 6 plus 2, the volume will increase. The dilution of the blood will happen. Whenever that we are doing an exercise for severe time, we just think about some person having taken severe, very hard exercises for a long time, but not taking, he is sweating. That means that the quantity of the blood will reduce. That time, some person having pain and some doing exercise for several prolonged severe exercises, we know that one of a person, Bruce Lee, what happened to him? He was taking very strenuous exercise for a long time, but he died because of his exertion. That is one of the reasons. So we have a moderate exercise is good, but if he is taking a severe exercise, then he has to change his eating habits and drinking habits. Otherwise, he will immediately what happened. I know that many of persons are taking going gymnasium they are living some life. Sometime their life will change. They cannot do that proper exercise for continuously. They could not do. That time what happened? Immediately they become very sick. And no medicines can do anything. That is what is happening so moderate exercise is good for healthy living. Let's go here. Hormonal control. Here we can see that heart valve, mitral stenosis, and here the problem is that if it is not opening, completely opening and coming on, it may go up. That is also controlling. Here we can see that coming blood here from the different part of the body and going here and going to the pulmonary area and coming through this and here reaching and going upwards. This is also one of the controlling factors for heart functioning. I already said that what are they affecting? Whenever there is nowadays COVID and that hormone COVID vaccines, what is happening here? After COVID, having many persons having these problems and taking this COVID vaccine, having this problem in conditions. Here, the heart. Whenever the heart, if the mitral valve is not functioning, here we can see that mitral valve. The mitral valve is not functioning means that it may becoming the size of this area will.
Excuse me, Dr. Hubert, it is not
Yes.
visible now.
Pardon?
The screen is not visible now. It is not appeared.
I'm still there. Okay. You saw that heart is functioning. If that valves are not properly functioning, the volume will increase, the heart muscles, the walls of the heart will becoming thinner and thinner and thinner. Endocarditis, the muscular volumes are having problems, edemated, endocarditis. In such cases, normally we have so many medicines. We homeopaths have so many medicines will help. Let us go to the medical part. I think that it is better for going to medical part. These are our medicines. I told fatty heart pericarditis, Adonis vulnaris. Fatty heart pericarditis, rheumatic endocarditis, Adonis versalis, and calmia, precordial pain, palpitation, and dyspnea. How beautifully doctors narrated this in our material. We know that most of the doctors were not in a state of condition. We know that 200 years back, 225 years back, also Dr. Hahnemann returned how hard the functioning of the heart and calcareous carbon level. We know that Dr. Kent. Now it is the science is very much developed, and we can see that. I'll show you. Even I'll show you videos here. We can see that the functioning of the heart and everything live. We can understand the things. We can say that what may happen. What are the difficulties? Cardiac asthma. We have medicines for cardiac asthma. Which medicine is? I think that arsenic alba, carbovegetabilis, cardiac asthma. Cardiac asthma, we may, I think that so many doctors I have seen many doctors treated, it is in allopathy hospitals. They are treating for even they could not distinguish cardiac asthma and bronchial asthma. They are giving treatment for cardiac asthma, no, bronchial asthma treatment. And the patient will not get relief. As a single question, we can understand that if that person, if that HB count is diminished, and person is taking deep sigh, that is a point where it may lead to cardiac asthma. Sometimes the lungs will be okay. They have some pain of the chest here and there. And they are taking deep breath. We can see that they are in sometime, whenever they are conversing with us, they are taking deep breath. That may be a cardiac asthma case. If we are taking for we homeopaths are taking all the cases, and we are taking going to a totality of symptoms, but we have to think which area of the body is more affected. If it is coming from the heart, then we must give importance to heart region. If it is coming from the lungs, we should give more importance to that area. If it is coming the nose, nasal orifices are not open properly, or there is any small space occupying polyps, nasal polyps, the percentage of air will not come. That time some doctors are giving asthmatic medicines. If we are treating for the that nodule, the nasal polyps, that case will be okay. So whenever we are taking the cases in detail, that time we have to go all through. We should not neglect any symptoms, but we have to give importance. That is the value, and we give the valuation of symptoms. That is very much important. Here, we can see that it is an important medicine we can use. Fatty heart pericarditis, rheumatic endocarditis, precordial pain. Precordial pain is more common, very common. Palpitation and dyspnea, marked venous engorgement. Venous engorgement. These are normally, we will not give much importance, but we have to go through venous engorgement. It is not happening in any of the area. It may happen all the body will have the venous engorgement or the venous problem. Each and every veins in our body may be affected. If we are treating that case, BP will reduce. Some doctors are giving medicine for BP. It is wrong. If we are treating for the venous system and the arterial system, artery, small arteries, that time normally the BP will come down. Then cardiac asthma, fatty heart, myocarditis. Nowadays, it is very much important because the lifestyle fully changed. Taking meat and fatty disease, and again, fat metabolism in our body. If the liver is not functioning properly, there is fatty heart. If the liver is not functioning, the production of liver, the bile, and the hormones and enzymes, the fat metabolism enzymes, we know that if the production of the fatty, production of enzymes for to regulate the fat metabolism, it may affect the heart. Myocarditis. Normally, we think that if we are taking that fatty food, that is why that is the reason. No, even the carbohydrate metabolism is not proper. It may affect fatty heart diseases, fatty liver diseases, myocarditis, irregular cardiac function, action, constriction and vertigo, pulse, rapid, irregular. These are all big cause. Even the carbohydrate metabolism is not proper. All these symptoms will come. So that we have to, why we are taking the constitution of a person? Why doctors are giving the constitution of a person? The fat metabolism or the carbohydrate metabolism. If a person is very fatty, we may think that he is taking very much fatty food. No, he is only taking carbohydrate food on rice and some curries on that. That time also these conditions will come. That time we are not giving giving treatment for heart disease. We have to treat the digestive system. That is why the Ayurvedic treatment, we know that in the Ayurvedic, most of the cases they are treating the digestive system. If the digestive system we make it proper, all the other system will becoming more healthier. First, we have to treat what is coming inside, what is going outside. The input and output, the regulating the input and output is normal, then the body will be normal. If the input is more, the output is not much, that time he become more and more fatty. If the input is, the output is more, we know that in Mersol, input is small, but the output is more. That means that the person is not in an equilibrium. So we have to use this medicine. We will get good result. Adoni's Bernard. Almost all heart diseases it may. For heart disease, but I told you that even we are treating the heart, we have to give other systems. And the production and the metabolism, anabolism and catabolism should be regulated. That time, other heart and the internal organ will be more healthier. Natrum muriaticum, tachycardia. Tachycardia, can you see it? Can you see it? Doctor?
Yes,
Dr.
it's
Manoj?
visible. Yes, it's visible. Okay.
Okay. Natrum. What is natrum?
It's not clear.
Clear. What is natrum? We know that salt. I think that it is a wrong decision of most of the doctors reduce the intake of salt. Salt metabolism is an important in our equilibrium of blood pH level. Tachycardia, sensation of coldness of heart and chest feel constricted, fluttering, palpitating, intermittent pulse, heart pulsations, fixed body, intermits on lying down. Don't think that it is a heart medicine. It is a whole body medicine. Some medicines are whole body medicine. That is natural more. That is why these are included in tissue remedies. System by system, we can treat a case in a system by system way, or otherwise in a general way, or in a particular way. These are all depends on the doctor's observation. So I think that the time is it okay? For discussion, I think.
8 minutes more, yes.
Is it enough? Is it enough or let us go something? Some more.
I think Dr. Amir Malik is capable of adding something, definitely.
Okay, then I can stop.
Yes.
Stop here. Thank you for
We
watching.
want to hear from Dr. Amir Malik.
Okay.
Yeah. Expert in biochemistry. Dr. Amir Malik, please unmute.
Hello, thank you very much, Honorable Sir. Namaskaram, greetings to honorable doctors and members of IFPH. Dear Sir, God bless you. Today's, Sir, you have selected very excellent topic. You know, it's a very, very big thing to teach the heart topic because it's so complicated to understand. But I have to say only 5-6 points about heart. First thing, it's made up of Purkinje fiber because its uses from the when the baby is in the fetus of mother, the heart developed at 6 weeks, and it was completed in 10 weeks. And the heart cannot beat without potassium. Potassium is the fuel for the heart. Second, heart produces 9 volt. If you touch the 9-volt cell on your tongue, you feel like little spark. But if 10, it will be paralyzed. That 9 volts produced by the sodium and potassium ionic pump. The region which produce 9 volts is SA node. Third very important point of heart, that 1 second. The 1 second of heart have 3 states: polarized, depolarized, repolarized. When the heart was depolarized, the heart will mute it for 0.8 second. It means when you go for your ECG, the PQRST, the first wave of the heart, it shows 3 conditions of the heart: polarized, depolarized, and repolarized. When the heart was depolarized, the potassium is outside and sodium is inside. When heart is polarized, sodium is outside, potassium is inside. Sodium carries 0.7 volt, potassium carries 0.5 volt. Now what happened? When there is tachycardia, the 0.8 seconds relaxation was off. It is not occurring. So the wave of the heart, the PQRST, will become like this. And the breathing is not controllable. Brightam or calibarometer accidentally control that situation of heart. And then we come to the heart valves. Heart valves are made up of protein. There is no benefit if you go for the if the heart valves are affected due to the fever or any other condition which is causes that the mitral valve is not working and another valves are not working. You know, one of my case of TOF surgery, tetralogy upfellow, a pulmonary valve was replaced. But what happened? It was not, the heart is not pushed back properly in the chest cage, and they have to repeat the surgery. And the boy is only 18 years old. He went in coma, and after our medicines, in 29 days he become normal, and the senses get back. So, Honorable Sir, a little bit. Heart tonic is Arjuna. Heart stimulant is Adonis vernalis. You have mentioned heart fibers, arteries blockage. You can open with the help of Crataegus. And one Chinese theory about heart. They said what you are saying, Honorable Dr. Hubert, you are saying very right. according to Chinese theory, heart is a baby and the mother is liver. Liver is the mother caretake his children, that is heart. If the liver is okay, if there is LDL, HDL level is okay, heart is okay. Only the cause of the blockage is from liver, always from liver. LDL will be deposit or HDL will be deposit. There is nothing third thing. You know, the people who always go for smoking and tobacco and having and chewing all the time, pan, I don't know what I have to say in English, pan. You know, they are not taking meat or another fried things, but their cholesterol is high. What is that? That is due to liver deficiency. So if we just purify the blood, heart will be purified. Actually, there is no benefit of if you go for the transplantation of heart, either for the valves, either for any bypass. The end is that after 10 years, again the vessels will be blocked, arteries will be blocked. And even the sugar patient having they are very, vessels and arteries are very weak because the decomposition starts in the blood due to the high sugar. So I believe by your lecture, by your details of medicines about heart and another things, definitely all patients will get the benefit. And your session is very, very excellent. I appreciate it, Honorable Sir, Dr. Hubert. It's really excellent, very good, very excellent. I appreciate it from bottom of my heart.
I want to ask
It's
you
really good.
one thing. I want to ask you one thing. Now I am going to ask you. Doctor, is there any medicine for the peripheral neuropathy, diabetic peripheral neuropathy? What is your advice?
Diabetic person medicine?
No,
Sir.
the peripheral neuropathy after diabetes.
Oh,
What is your
peripheral neuropathy.
Yeah.
Yes, peripheral neuropathy. Actually, sir, for any neuropathic pain, you have to find the cause, and cause is one: peripheral neuropathy, either diabetic neuropathy, either kidneys neuropathy, either eyes neuropathy. You have to control all enzymes and toxics levels. This is very important. My personal opinion, to overcome the peripheral neuropathy, you must cleanse the toxics from the body. And the super fit medicine to overcome neuropathic pain is urea. You know, urea is our medicine. Urea is the biggest toxic. If there is a neuropathic pains, peripheral neuropathy, there are some different medicines for the peripheral nervous system because it was attached by the unconscious. When we go for sleep, we are dead because the switch of the central nervous systems are off, and our system converted through the sympathetic system on peripheral nervous system. If there is a peripheral nervous system neuropathy, go for also oxalic acid and picric acid. It will help to reduce that.
Thank you.
And
Okay.
yes, sir.
Very helpful. Very much helpful.
So very oxalic acid and picric acid will excellent give you result about the neuropathies.
Yes.
If the neuropathy of the peripheral nervous system, it will be very good medicine.
Okay.
Thank you, doctor. Thanks.
It's a mini encyclopedia, Dr. Amir Malik. Thank you, doctor. Yes.
Thank you very much, sir. God bless you, sir.
No.
Greetings.
Yeah. Good evening, sir. Your lecture was very informative. Actually, one query I would like to ask. We receive post-infarction patients many times, and they complains of anginal pains. So, can there be some remedies good which will reduce down the anginal pains? Because Cactus G is normally given. It works in few patients. In some patients, it does not work.
I have a
They
treatment
have a
pattern.
panic that they are getting second
There are
attack.
4 medicines. Spidelia, cactus, carbovage, China.
Okay. Yes.
Okay.
Yes.
Spidelia,
Okay.
cactus, carbovage, China.
Yes.
This,
Now,
these
Dr.
4 medicines.
Indranil, you can say express sort of thanks to you, but please, Dr. Indranil.
Okay.
Yes, sir.
With apologize, little interruption. Amyl nitrosum. Amyl nitrosum is very effective for angina. Very good.
Yeah.
It's
Very true.
Arnica. Arnica itself will
Yes, sir.
help.
Yes. Time to
Arnica and belladonna.
please.
Yes, sir.
Please.
Very, very effective, sir. Very effective.
Yeah. Sir, in neuropathy, would like to add only one. With practical experience, I have seen that this is inflammation of the nerves in diabetic neuropathy. Plumber metallicum,
Exactly.
zincum met, and the metal remedies really do wonders.
Thank
Correct.
you,
Thanks
doctor.
for your
Very good.
information.
Very right, sir.
Okay.
Very right, sir. Absolutely right. Agreed, sir. Agreed.
Thank you, sir. Yeah.
Thank you.
Yes, that's all for today's English edition. Back again tomorrow. Till then, goodbye. And Dr. Mariama will continue the program. Malayalam. Namaskar. Thank you.
Thank you all.
Doctor.